Is Medigap Plan N really worth the savings over Plan G? This video is about the second most popular Medicare supplement plan, Medigap Plan N. I believe that many people shy away from the Medigap Plan N because they're misled about some of the Plan N features. It's sadly far too common for some Medicare insurance agents to use fear tactics subtly, but to use them to steer people away from a Plan N and towards other higher commission Medicare plans. The truth is, Medigap Plan N is often the best value Medicare supplement plan, balancing both low premiums and great benefits. That's one of the reasons I believe that everyone researching a Medicare supplement should consider Plan N to your other choices. But a fair comparison can only happen when you know the facts, which is what I will detail in this video. Plan N is also typically the lowest cost Medicare supplement of those that offer full coverage. I consider full coverage as paying 100% of the inpatient care, Part A, and that's both the deductible and the coinsurance that Medicare leaves as the patient's responsibility. However, did you know that some people pay more for their Plan N than their neighbor pays for a Medigap Plan G? I'll reveal to you how that can happen, as well as other potholes to avoid, as we take a deep dive into Medicare Supplement Plan N and the information that you need to know so that you can make an informed decision. So stay tuned. At the bottom of this video is a menu system, and in the show notes, a clickable table of contents. Using either one of those tools, you can move to whichever part of this video interests you the most. In order to keep this video relatively brief, I will not review what is a Medicare supplement plan or why choose a Medicare supplement plan over an Advantage plan. It would simply make this video unbearably long. If you want a detailed dive into what is a Medicare supplement plan and why consider a supplement, please see my videos, Medigap Plans Explained and Medicare Advantage versus Medicare Supplement Plans. The link will be above my left shoulder and of course in the show notes below. Both of those videos are filled with information that you should know before choosing a Medicare plan. That said, when we consider Medigap plans, I'm often asked, what does this plan cover? The mandate of Original Medicare is to cover everything that is medically necessary to diagnose and treat any conditions, disease, or injury. No prior authorizations required, no referrals needed. If Medicare covers a procedure or service, the Medigap plan will pay the appropriate coinsurance or deductible, no questions asked. All a supplement is meant to do is to pay the gaps in Original Medicare coverage to limit your out-of-pocket expenses. Now, let's look at Medigap Plan N. The table of benefits for Medicare supplement plans lists the 10 different plans across the top row and the benefit categories in the left-hand column. Just like Plan G, a Medigap Plan N covers 100% of Part A coinsurance, deductible, and hospice care. With a Plan N, you can be in the hospital as an inpatient for over a year, and all inpatient charges are covered 100%. Also, just like Plan G, with a Plan N, you will pay the Medicare Part B annual deductible. That deductible is paid just once per calendar year when you first see a doctor. The 2024 Medicare Part B deductible is $240. The 2025 Part B deductible has not been officially announced yet, but the official estimates suggest it'll be $257. But at the time of this video, that's not yet official. Still, it's under $300 and not a significant expense. Again, that is an annual deductible for outpatient services and paid when you first see a doctor during any calendar year. Now let's look at the differences. Medicare Supplement Plan N is different from Medigap Plan G in two important ways. The first difference is shown here with the 3 asterisks in the Part B coinsurance row. The Part B coinsurance is the 20% Medicare leaves as the patient's responsibility for Part B outpatient and physician services. Medigap Plan N pays all of that 20% for you, but you will have up to a $20 copay for doctor visits and a $50 copay for emergency room visits. Technically, the office visits or emergency room copay is a co-insurance. The rule as written is 20% of the medical bill up to a maximum of $20. That means when the Medicare bill for an office visit is less than $100, your copay will be less than $20. But your copay, it can be less than $20, but can never be more than $20, whether you're seeing a primary care physician or a specialist. There are also important details about when this copay can be charged and when it cannot that are very important to any decision to purchase the Plan N as your supplement. So let me share with you that detail and then provide examples for clarification. And this is important to remember. You're only charged the $20 copay for specific doctor visits, not every time that you see any medical provider. Your doctor visits must be for a diagnosis or evaluation to trigger a copay. There are specific billing codes that trigger that copay. If you see a doctor because something hurts or you don't feel well, that's a visit for a diagnosis. You want the doctor to diagnose what ails you. If your doctor prescribes a medication or puts a cast on you and asks that you come back in 30 days, the return visit is an evaluation. It's intended to evaluate if the medication or other treatment is working. Those are the visits that trigger a copay. There's no copay for physical therapy. There's no copay for chemotherapy sessions or vaccines. Keep in mind, billing mistakes happen, but with this knowledge, you can correct them. In fact, just a few weeks ago, we had a Plan N client reach out to me because she was getting a $20 copay for every physical therapy session. I provided her with the information she needed to present it to her physical therapist, who then refunded the copays that she'd already paid and rebilled the physical therapy sessions correctly. Since COVID, telehealth visits and urgent care visits have adopted new billing codes that now qualify them for the copay. So you may pay a copay for telehealth and urgent care visits. The second difference between Plan N and Plan G is the one that frightens potential Medigap Plan N purchasers the most. But it shouldn't, and I'll show you why. That difference is that Plan N offers no insurance protection against Medicare Part B excess charges. I want to address excess charges in detail because many agents mislead the public using scare tactics to lead people to purchase a higher commission Medigap plan. If you've already seen my video, Excess Charges Are Dead, you know what I'm about to say. Neither Original Medicare nor Medigap Plan N covers Medicare Part B excess charges. I have a lot I want to say about Medicare Part B excess charges, but when I wrote it all out, it was over 10 minutes on this one subject. So instead of going through the details of why Medicare Part B excess charges are a non-event and should never be used to dissuade you from getting a Plan N, I'm going to go through just the bullet point highlights. If these bullet point highlights are not enough to convince you, please see my video, Medicare Excess Charges Are Dead, where I do provide details and receipts to prove that you should not be concerned about excess charges. So here's the bullet points. A doctor cannot charge an excess charge unless they have a contract with Medicare that allows them to do so. It's called a non-participating provider contract agreement. Only 2% of doctors that accept Medicare have a contract that allows them to charge an excess charge. So this shows Medicare's announcement that for 2025, 98% of all doctors accept Medicare assignment and cannot charge an excess charge. Now, in the show notes below, I have a PDF on this from Medicare. When a doctor accepts Medicare assignment, they agree to accept Medicare's rates as payment in full for any service or procedure. Of that 2% of doctors that do not accept Medicare assignment, 4 out of 10 are mental health practitioners, 2 out of 10 are chiropractors. That means that less than 1% of general practitioners or specialists charge an excess charge. You can see 100 doctors and not find one that charges an excess charge. Next point. No major medical institutions charge an excess charge that I am aware of, and we work all across the country. The last one to do so was Mayo Clinic, and they stopped as of 2020. The probability is that you will go through your entire Medicare experience without ever running into a doctor that charges an excess charge. Doctors that charge an excess charge must inform you first before the procedure. That is the law. There can be no surprise excess charges. Doctors that charge an excess charge cannot bill your supplement, so they will ask you to pay them up front before services are performed, and then you are reimbursed by your supplement. According to Medicare, the average excess charge for 2023 was $50. Just $50, that's it. Also, there are no Part A inpatient excess charges. You cannot be surprised by a huge excess charges after a long hospital stay as an inpatient. Medicare has a program started in 2010 that rewards doctors who accept Medicare assignment and discourages doctors that charge an excess charge. Because of that program, there are fewer and fewer doctors charging excess charges every year. The incentives to accept Medicare assignment are simply too great to ignore. Those are 10 quick bullet points. Now, if you would like more or you need more detailed information, please see my video, Medicare Excess Charges Are Dead, linked above my left shoulder and in the show notes below. And in that video, I actually show a clip or two of an agent spreading misinformation on YouTube. Last point on excess charges and agents that try to steer you to a higher commission plan. These are the 4 things that I hear my competition say about excess charges when trying to steer you away from a Plan N. I've heard you never know when a doctor can add an excess charge. You can be on an operating table and the anesthesiologist or other doctor can charge an excess charge. I hear that more doctors are charging excess charges now and will be in the future because Medicare doesn't pay enough. Or most specialty hospitals like Cleveland Clinic and Mayo Clinic charge excess charges. And my favorite, my mother's brother's nephew, had a $250,000 excess charge. It might bankrupt him. All are false, and when you hear a comment like this, please question the motive. So next, let's take a quick look at why the Medigap Plan N is often considered the best value Medigap plan. In general, the Medigap Plan N should cost less and have a lower price increase history than the Plan G from the same company. Note what I said there, from the same company. With a Plan N, just like with any other Medicare supplement plan, the insurance company you choose will have a greater impact on your price over your lifetime than the plan you choose. Over time, a Plan N with the wrong company can be more expensive than a Plan G with the right company. I've seen videos where an agent cherry picks some price increases to prove a point that Plan N has lower price increases than a Plan G. That is not always the case. I can show dozens of examples of Plan N price increases equal to or greater than a Plan G from the same company. But over the long run, Plan N should have lower price increases by design. Still, you should expect your Medicare supplement plan to double in price over the next 13 to 15 years. Make sure you have the budget available for the inevitable price increases. So why does Medigap Plan N have lower price increases? There are 2 reasons for this. First, the $20 copay keeps people from going to a doctor for frivolous reasons. Medicare studies dating back to 2011 found that when there's a $20 copay per visit, people hesitate to see a doctor unless needed. That saves money for Medicare and for the supplement. Second, and most important, is that the pool of people in a Plan N tend to be healthier on average. Why? Well, healthy people who almost never see a doctor are not usually concerned about a $20 copay. It's just not an issue. But a person who's turning 65 during their initial enrollment period, when there's no medical underwriting, and who's not in the best of health, may already be seeing their primary care physician twice a year, plus 1 or 2 specialists. Those people worry about the copay. The copay eats into the value of the plan, and they fear that they'll only see doctors more often as they age. The result is that those people with the lower health often avoid Medigap Plan N when turning 65. And as a result, leaving on average a healthier pool of people with fewer medical needs. If you've not heard that information before, please thank me by pressing the like button below and consider subscribing for more of my Medicare videos. So who else usually chooses a Plan N over a Plan G? People who choose a Plan N are value conscious. They are people who like to save money. They often wait for sales and don't mind paying the $20 office visit copay because they know their monthly premiums are lower. Now, is a Medigap Plan N really worth the savings over Plan G? There's a very simple way to make that determination. Because excess charges are not only rare but are easily avoidable, the only material difference between the Plan N and a Plan G is the $20 doctor visit copay. That's it. In some states, Medicare Part B excess charges are forbidden. So again, the only difference is the office visit copay. And we will discuss that with you when we talk with you on our one of our licensed Medicare experts, and they go over any of your state-specific rules that can impact your decision. What I do to determine the value of a Plan N is to simply subtract the monthly premium of the Plan N from the monthly premium of the Plan G that you may be interested in or you're comparing it to. Then divide that number by $20 to determine how many doctor visits per month it would take for the Plan N to no longer be a good value. For example, let's say that your Plan G is $135 a month and your Plan N is $115 per month. That's a $20 per month difference. $20 is one office visit copay. That means that you would need to see a doctor more than once per month, every month, for the rest of your life for Plan N not to be a better value than Plan G. And that is very, very unlikely. In fact, I wonder, do you know anyone who sees a doctor more than 6 times per year? I mean, if you do, let me know in the comments below. I'd like to know how common that might be in your experience. So in my opinion, when the difference in price between a Plan N and a Plan G that you're considering is $20 a month or more, Plan N is the better value, hands down. There are some places in this country, by the way, where there's a $50 a month or more difference in between the Plan N and the Plan G. And there are other places where the difference is less than $10 a month. I personally recently started my Medicare. I personally chose a Plan G because I simply don't want to deal with medical bills, and that $20 copay would annoy the heck out of me. But that's my personality. So tell me, would the $20 copay annoy you, or would you rather save on the monthly premiums? Are you a Plan N person? Let me know in the comments below. And if you found this video helpful, please press the like button and subscribe for even more content. And when you do, it encourages the YouTube algorithm to share this video with others. I'm Matthew Clausen at MedigapSeminars.org. Thank you for watching.